Hello. Good morning, everybody. Thanks so much for coming out this morning. I'm Michael Kasparian. I'm president of your Falmouth Chamber of Commerce. We're really excited you're all here. And there's a great crowd coming out. And I'm not surprised, because here in Falmouth, we really care about our community. And it's really wonderful today. Also, before we begin, I just want to recognize a couple of folks who are here. Our state representative, Dave Vieira, is here, which is great. Obviously taking notice and supporting our healthcare system here. And also, Board of Selectmen Bob Miscali is here as well, so representing the board. Yeah. One of the wonderful things about living here in Falmouth, and one of the great benefits that we have, not only to businesses and to second homeowners and visitors, but to all of us, the entire community, is this amazing healthcare system that we have, and the fact that we have our own hospital right here in town. So, I can speak for myself, as I'm sure all of you have visited the emergency room, have had procedures, visited doctors, and just how wonderful it is to be able to have the type of services right here without having to go over the bridge and far away. We like to put it that it's neighbors taking care of neighbors, and really nowhere else is that more true, I think, than here in Falmouth. So it is really our pleasure to have Mike Loft, the CEO of Cod Healthcare, here today to talk about the Upper Cape, the services, Falmouth Hospital, and then take some questions. So without further ado, I'd like to introduce Mike Loft.
Well, thank you, Michael. And Mike is one of the best in the business. And you better be pretty damn good to get the weather like this on a big Falmouth morning. So it just reinforced all the good things that I've thought about you. But honestly, Michael and the Falmouth community, the chamber, the business leaders, our economy is run and dominated by small business, by the incredible governments and towns that we work with, school systems, all the people that make us who we are. And I can't thank you enough. And the chamber, I have to say, Michael is always advocating so much on your behalf, as well as his great team. So thank you again, Mike. Really appreciate being here. Driving down this morning, it wasn't lost on me that the weather had finally changed. The leaves were starting to come out, and it's a time of optimism. Falmouth Hospital has been open for more than 60 years, and I remember when we had the 50th birthday celebration in 2013, all the things that we promised and all the things that we would do, and I'm happy to say we've done them. But I'm more proud to say that we're still a not-for-profit, independent, community-owned health system that is solely responsible to you, the people that live in this community. And given all the things that are happening today, all across our state, all across our country, all across the world, the fact that you control and own your healthcare system is very important. And I will touch on that in a bit. See, the fact of the matter is, we never ask people what they have or where they're from or what they believe in. We simply ask what's wrong. We're a mission-driven healthcare organization whose sole purpose is to coordinate and deliver the highest quality healthcare services for all of Cape Codders, for all of our visitors. We do that to improve our life. We do that to improve your health. Each and every day, Falmouth Hospital sees 150 patients in the ER, right? Performs 15 and 20 surgeries, admits 15 patients, discharges just as many. Thousands of outpatient visits. Each and every day we deliver on that promise. And while we are not infallible, we really do strive every day to make sure that you can trust us when we will be there when you need us. And I wanted to reinforce that this morning because it reminds me of a simple poem that I read often to an entire team. Do all the good that you can, in all the ways that you can, for all the people that you can, for as long as you can. That's what Falmouth Hospital, that's what you and this community represent. The fact is we employ 750 people, over 100 physicians. We have hundreds of volunteers, the auxilians, all the people that make us tick. And by the way, Vicki Lowell's vision, that of the part of the Falmouth Hospital Board of Trustees, the Cape Cod Hospital Board of Trustees, their vision well over 30 years ago to bring us together is the sole reason why I could give you that opening. If it weren't for her and her leadership and the vision of so many in this community, we wouldn't be where we are today. We owe a debt of gratitude for people that have come before us. And our job is to position this organization for all the people that will come after us. Falmouth Hospital has had a remarkable run. We're a part of the Cape Cod Healthcare system. It's an asset whose importance cannot be underestimated. The fact is we have 2 urgent care centers in the Upper Cape. We have 3 dedicated outpatient centers. We have 20 primary care physicians and nurse practitioners. We have surgeons that are only here because of Falmouth Hospital and you. If we don't employ physicians today, they simply can't come. Because if you haven't heard, we're dealing with a little bit of a housing crisis. We're dealing with a little bit of a workforce crisis. We're dealing with a lot of crisis right now. 74% of everyone that we see in our hospitals are on some sort of governmental insurance. We're dominated by Medicare. We have Medicaid. And that's why only 26% of all of our income we get to negotiate for. That's a fact. Only 26%. If you look at all the people that are duking it out in Boston, they're talking about 50% of commercial opportunities. But with that, we have excelled, and we will continue to grow. We've privatized all the patient rooms in Falmouth Hospital. If you walk through that tower today, you will see how warm and fresh and clean and inviting it is. We have made sure that we have a state-of-the-art intensive care unit that can service the sickest of the sick to ensure that you can stay in your community. We have made sure that we've revitalized outpatient centers, as I mentioned. We have touch points all across the Upper Cape, and we do that because we believe you should be able to access a primary care physician within 15 minutes, receive your specialty care within 30, and to make sure that you have a local hospital that's open 24/7 to take care of your needs. We have a border crisis. Each and every day we wake up, we're housing 30 patients that can't either be sent to skilled nursing, they can't be sent to long-term care, or can't be sent to state hospitals or other organizations that specialize in behavioral health. Each and every day we start with our purpose in mind. How can we achieve great results? And I have a wonderful team that's here today at Falmouth Hospital and all of Cape Cod to support that very vision. So what are we doing? How will we continue to excel? As I mentioned, we have 750 people, and our workforce is really our biggest challenge. We have over 500 job openings at Cape Cod Healthcare, 5,000 people in total. We have today 300 travelers as we sit. We have upwards of 35 and 40 at Falmouth Hospital. We have to go and get those travelers to ensure that we can deliver on the very mission that I stated, but it's not a long-term strategy. You don't build culture with people that live all over the country. So how will we get there? Well, the good leadership of our governmental leaders like Representative Vieira, we're able to go out and partner with 12 colleges, universities, community colleges, tech schools, high schools. We're bringing hundreds of people through our door each and every year to try to make sure that we're growing our own. What's fascinating about today is Cape Cod Healthcare has one of the first programs in the country in which we're going out and actually paying people to train them. We're going to make sure that people have the ability to come in. We're making sure that people that go to community colleges get all of their clinical rotations with us. And when they're done, should they continue their career, we'll be able to subsidize their tuition. We're doing that with colleges and universities alike. We have to make sure that we find ways to bring people in. We partner with UMass Medical School. 16 medical students that one day will be our future doctors have rotate through our organization, including Falmouth. It's a long-term strategy, and this past year, we just hired our first 2 physicians from that relationship. We also partner with others because when you're like us, we're a $1.1 billion company with 5,000 employees, 88 locations across the Cape, from Falmouth to P-Town. When you're like us and independent, you have to partner to make sure that you can maintain the services that you need, not only educationally and at the high school level, but how do we partner with our employees? How do we change culture? We have to give them opportunities to grow their career. The average employee today stays 2.7 years. Did you know that? 2.7 years, so there's always a turn. But I'm happy to say, because of the great leadership at Falmouth Hospital, our turnover rate sits at 9%. That's better than 50% of the state average. We're keeping our own and we're expanding our vision. Not only do we partner with UMass, but we also partner with Dana-Farber. Being in the Dana-Farber Cancer Care Collaborative has allowed us to be able to expand our clinical offerings in oncology. Second opinion clinics, medical specialists coming here to partner with us doing complex oncologic surgery. And this year we just started our clinical trials program. Clinical trials that we could never get on the Cape are now being offered. 2 have just started, 3 more to follow. We're keeping care local through these partnerships, including Boston Children's Hospital, and also a clinical affiliation with Beth Israel Lahey Health, where we have a cardiac surgical program in Hyannis. So how do you build a community-based hospital? How do you build that outpatient clinic? You build it through partnership and through vision. You build it through a dogged determination to deliver. At Falmouth Hospital, our key will be to make sure that we provide primary care access to you. And as I mentioned, we have over 20 in the local community, including nurse practitioners. But we have to expand that. And 2 new physicians will be here by August. We've been able to expand our hospital-based outpatient clinic with Dr. Korn. We've been able to go into specific communities to make sure that we have access. And I'm happy to say today, if you need a primary care physician, you can call us and we can get you in within 2 weeks, 100% of the time. But there's more work to do there. We have to expand our general surgery program. We have to make sure that we continue to do the great work that Jack Hostetter and his team have done in cardiology. We have to make sure that we have a strong emergency room, strong radiologic services. We have the Seifer Cancer Center over there, and they've done an amazing job making sure that people can get all of their needs met in the Seifer Women's Health Center. We have to make sure that we provide high-end services in a community setting. But much like every business on the planet, healthcare is evolving. Healthcare is evolving in ways that we can never even imagine. The introduction of telemedicine, the introduction of hospital at home, the introduction of our EMRs, in which you can now get your results in our EMR Epic MyChart anywhere you go in the country and share them with your provider. Pull up your lab values, look at your prior scans. It reduces the cost of care. But as I mentioned, healthcare is evolving, and integration, clinical integration, will be our key. How do we partner with ourselves? How do we make sure that we have offerings that if we can't offer them in Falmouth, that we can in Hyannis? Because 95-bed hospitals can't have everything anymore. The fact of the matter is you can't recruit physicians that will be on call every 3 nights. The new rule of thumb is every 5 nights, often every 7 nights. Healthcare is changing. People don't want to come to hospitals anymore if they're ambulatory-centric. People that work in hospitals don't want to go out into the community. How do you coordinate and deliver that? Not only with the EMR, but through partnerships in Hyannis. As I mentioned, our cardiology program, incredible cardiac care will be delivered here. And if you need interventional procedures as well as surgical procedures, we've just been rated one of the top 5 percentile in terms of quality and safety for cardiology in the Commonwealth in Hyannis. But we're also bringing EP services back to Falmouth Hospital. Dr. Peter Burrell, partnering with Jack Hostetter's team now, is doing EP clinics two times a month. And our idea is to continue to bring more services because Falmouth Hospital will be here for the long run. Our job is to make sure that we're talking about us in 60 more years. Although, Vicki, I will not get the platitudes that I just gave you, but somebody will say something nice, I'm sure. We will continue to grow, and to do that, we're also investing in trauma services. I saw the fire chief here this morning. To make sure that local EMTs and paramedics can stay in their community. Level 3 trauma will be achieved at Cape Cod Hospital in the fall. Because now we have a great community asset, a wonderful community-based hospital that partners with a tertiary-based academic light medical center in Hyannis. And then if we can't take care of you at our 2 campuses, we will make sure that you have the services that you need in Greater Boston. As I mentioned about the community aspect of who we are, I mentioned our economic impact locally. But if you think across the Cape, Cape Cod Hospital is now about 10% of our GDP. Every dollar we spend means $1.53 in our local community. Our goal at Falmouth Hospital and for the Upper Cape is to grow employment, is to give people reasons to stay. That's why we have our nursing programs, to give high school kids that opportunity to show that they can not only be employed with us, but hopefully someday take my job. We've invested significant resources in DE&I, making sure that we're addressing the needs of a community that has far often been overlooked. But we're doing it with a structured plan led by Dr. Kumara Siddhartha and over 20 community-based representatives. This plan has been developed with a 5-year goal to actually improve the healthcare conditions of our community. We desire no trophy. This is simply doing what is right. Investing in our future, investing in our citizens, and giving people like over 20 that have already graduated our English as a Second Language program. They've been able to come in without being able to speak our language, be gainfully employed, while not only learning English, but also many of us are now learning Portuguese and learning other languages to more closely relate with them. We want to give people opportunities to not only receive care here, but to grow their lives here. And that's what the Chamber is all about. The Chamber is about partnering with you to position ourselves as not only a wonderful place to work, but a wonderful place to live. So what do we do about housing? I don't know. Are we prepared to have the type of conversations that are needed to get meaningful work done to grow the housing stock? I've been here 16 years and we're not. It's too hard to build houses. So what do? You get in a room like this and we talk and we think and we decide, what does it look like? How do we do it? Because we have the highest wages right now on the Cape. And I can tell you, we're losing nurses to Plymouth at a rapid rate because it's cheaper to live there. We have a wonderful community. It doesn't mean we can't have more housing. It doesn't mean that we will destroy our environment. It means that we have to have a vision, very much like we're trying to do at Cape Cod Hospital. We're an independent, not-for-profit, community-owned healthcare system. And right now, the Commonwealth is grappling with a very real issue. It's called private equity. And I have nothing against capitalism, nor do I have anything against private equity. But for Massachusetts and the leaders to say they didn't see this coming would be disingenuous at best. Steward Healthcare is crashing as we speak. They just declared bankruptcy in the middle of the night. What they did was a classic private equity trick. You come in and you give back these companies their AR. Well, by the way, you already own your own AR. You say you're going to invest hundreds of millions of dollars back in the local community, but in fact, you sell the very hospitals that you aim to protect, you take the money, you leverage them to the hilt, and you go buy others in other states. The rent payments get too high because they're serving many communities that can't afford to go anywhere else for care. And what do? You see the erosion of trust. You see the erosion of care. That's not the model for us. The model for us is to stay who we are, to partner with others, to expand locally, to give people meaningful jobs, to be a part of the housing process, not the leader of it. We're willing to partner with you not only in healthcare, but in all aspects of what makes this community great. And we will continue to double down on that. I mentioned the partnerships that will keep care local, but more importantly, it's us. We determine our own fate. Cape Cod Hospital, Falmouth Hospital, the incredible JML Care Center, Heritage, our VNA, our medical affiliates of Cape Cod, all of those assets make us who we are. We're all mission-focused. Led by the Lilies, the $15 million that was invested in JML has made it second to none. But our responsibility is to get that staffed, and we're not there yet. Colleen Pino's done an amazing job, but we're still at 80 beds. How do we get to 132? Because we can't get patients out of hospitals until we can get them into skilled nursing. We can't get patients out of ERs until we expand our behavioral health footprint. We also have to work hard through a new initiative we'll be starting in the next year at Mobile Integrative Health, where we have to keep you in your own home. We have to make sure that you don't come to the ER. When you're discharged, you're well cared for after the fact. There's lots of ways we can improve. I'm happy to say that Falmouth Hospital is 5-star CMS rated. That's all based on clinical outcomes. Happy to say that they're B in Leapfrog. I'm happy to say that we're a vibrant organization, but we will be nothing without you. This incredible community has supported us for over 60 years. And I go back when I was doing my research in the very beginning to the bake sales and how people would go door to door and how the VNA was started in this community well over 100 years ago. All the things that make Falmouth special is what makes Cape Cod Healthcare special. We have lots of stories that we can tell you about the good work we've done, but your support is better. Your willingness to come and invest your time, to invest your money, to invest your clinical care in us is why we're here. And I couldn't be more thankful. So on behalf of Cape Cod Healthcare, I'd like to thank Michael and the Chamber for having us here today. I'd be more than willing to answer any questions that you have about us, and I truly appreciate your time. Thank you very much. Any questions? Maybe I covered all the topics. Yeah, Representative.
Thanks, Mike. I'd like you to tell us a little bit about what Cape Cod Healthcare has done when the Commonwealth pulled back on the sexual assault nurse examiner program as they went to telehealth and really were trying to shut the program down here on the Cape.
Well, I want to thank you for that as well. The Commonwealth of Massachusetts determined the people that are dealing with sexual abuse and assault would be better served by having nurses from off the Cape do the examinations using technology. And that wasn't the right solution. It wasn't the right solution for these victims. So with Representative Vieira's leadership, we put together a training program. He fought hard from a regulatory perspective, and we signed up a bunch of people that wanted to go through the training. We're happy to offer those services. And I won't get into the specifics, but the heartbreak of what some of those nurses and our doctors have had to deal with this week in our ERs would shake us all to the very core. So they're vital services, they're needed, and we offer them 24/7 here on the Cape.
Thank you, Mike, for being here, and it's heartening to hear that you're anxious to help deal with this housing crisis, which everyone in the room knows is the biggest crisis facing Falmouth right now. But my question is back to Steward Health and what its impact might be here on the Cape and what actions Cape Cod Healthcare may be taking to anticipate those impacts.
That's a great question. The impact directly to us will be very little. St. Anne's is the closest to us, and we won't really be able to draft employees from any of the other hospitals in their network. They dominate the North Shore and have some good assets down here in the South. But we were we jointly contracted with Steward for well over 14 years in our physician network. We have something called a Physicians Hospital Organization, the Cape Cod Healthcare Preferred Physicians. And we were in the risk deals that we were in for many, many years. And years ago, we saw the train going off the tracks, and we exited that physician relationship. That wasn't hospital-based. It was all physician contracting. And it cost us a lot of money to get out, but looking back at it, it was such a good decision. We now completely contract on our own as Cape Cod Healthcare. So financially, we've already weathered that storm. Clinically, it has zero impact on us. Won't be able to recruit many patients nor more employees or potential healthcare workers from over there, but it's going to impact Massachusetts greatly. South Shore Hospital, is roughly a little bit bigger than Cape Cod Hospital, and it routinely runs at about 200% of licensed occupancy each and every day. So everyone from Brockton and some of the other areas, Norwood, have rushed onto the scene. So you're seeing some hospitals really stressed. And then just so you know, when I mention travelers and I mention, you do realize we're one of the few organizations that have staffed every single bed since the pandemic began. Many people are not staffing beds for profits. We have never, our board of trustees has never once said, you can't staff beds for profitability. We staff beds for everybody, and I'm really quite proud of that. So, we've made mistakes, but but I love where we are ethically and morally, and I think we do it the right way. So Stewart is a crisis that will have reverberations through healthcare policy and healthcare financing for a long time to come. Everybody got paid, but the communities that owned the assets, and that doesn't seem right to me.
Thank you. Peter Hargraves. Thank you for your leadership at Cape Cod Healthcare. I'm a very satisfied customer, and I've always been impressed that every time I go there, I get much more than I expected. So thank you for that. Listening to your talk, it very comprehensively covers a lot of issues, and possibly the answer to my question was buried in there. But I was interested in the 9% turnover. Some amount of turnover is healthy for the organization, and some of it is not controllable by the organization. But in a situation you described, the employee who's in place doing a good job is the most valuable person you can have because of the inefficiencies of onboarding and such. So I'm sure you've done, I'll say, exit interviews. Have you identified things that are within your control as priorities for making Cape Cod Healthcare the choice for healthcare professionals as their employer?
Well, it's a great question. Let's start with, we do exit interviews, and we know that most turnover is voluntary. Involuntary would be us terminating the employee. Most are voluntary. The phenomenon that we've experienced is we haven't lost nurses to off-Cape per se, some travel, of course. We've lost nurses to per diem status. So when you sign up for a regular shift and you're a full-time employee, you have to work your X number of weekdays and weekends. When you go per diem, you have to work some weekends, but you get to pretty much name your own schedule. So we've lost employees to, I think, flexibility in their pursuit of how they want to live. And I think most people are grappling with that. Our job is to find ways to bring them back to full-time. Our job is to make sure that one, as I identified, the number one reason people stay is for the mission. So we need to make sure our culture is right and people know that. Two, the second reason they stay in these very exit interviews and surveys we've done with our employees, they stay for each other. So think about that, mission and each other. I wasn't on the list, clearly, but we have to capitalize on that. And we need to create some flexibility, but we do need people to come back part-time, full-time, not per diem. We have to work hard through that, give people reasons to come back. We have enough nurses. We need more full-time and part-time nurses. I'm proud of our turnover rate. Carter Hunt is here, Chief Operating Officer. Rebecca Day is here, Chief Nursing Officer. Chris Lawson runs our foundation. And by the way, just so you also know from a community benefits perspective, we spend about $35 million locally in our community with uncompensated care, as well as supporting local not-for-profits, which are well over 50, so we're investing back in. We need to provide the career growth, give them opportunities. I'm proud to say most of my team I've hired, promoted up through. Rebecca was a staff nurse, supervisor, manager. Now she's a VP. Same with Lori Jewett up in Hyannis. Same with Mary Johnson up in Hyannis. We've diversified our team. We've invested in our own. But also, you need some external influence, right? You can't just limit your pool. At times, it's very healthy to get external perspective to come in to teach us new tricks. So it's a balance. But our turnover rate's great. Our traveler rate isn't. And we need to do more, and it all does revolve around culture. There's some rules that have been in place for 50 years with regard to our contracts, and we're not going to get around those, right? If you're new, you're still going to work nights. If you're this, you're still going to do this. I can't get around that, right? But we have to find reasons, and I own that. I can't say, oh, the market's the market. No, I live in the market. It's time to go. So we're stable, but we have to do better. Great question.
Good morning, Mike. My name's Margaret Teege, and I came from the tech world, and I know that sometimes the medical industry can be a little bit of a late adopter to technology because of all of your regulations. So I was wondering if you could comment on artificial intelligence, what you think the biggest excitement is about that, or the biggest opportunity, and what are you most afraid of for artificial intelligence in the healthcare industry?
Great question again. AI is so powerful, right? Because it collects data from all these disparate sources and is able to tell you stories, is able to look at trends, is able to see it before you do. AI is going to have a very meaningful impact in healthcare. I don't know that I ever want any one of us to speak into a microphone and have a computer tell us our diagnosis. But I do think that there's incredible opportunities in the early identification of things like sepsis, which is an infection that kills far more than anybody realizes. You know, when you come into the ER and you have a temperature and you're hypertensive and you're dehydrated and you're doing some studies and we know you're on the clock for sepsis, it really does identify opportunities very quickly. Imaging, you know, it shows you that a computer can read our diagnostic images as good, if not better, than our own radiologists. But do we want a computer to be our final read? Healthcare is still a people business. There will be great advancements with technology. It will be adopted. But as far as I can tell, a computer doesn't have a moral compass. And we have to ensure that we judge each person fairly, not based on a computer-based algorithm, but based on a physical examination, listening, and being able to relate. So I think we're going to walk fine lines with some of the ethical aspects of AI. I think it will be adopted. I think it will leapfrog us ahead. I think it will replace key workforce areas. And I think it will improve care if used judiciously.
Thank you very much. My name is Laura Moynihan. I am with the Falmouth Housing Trust, and I too was very inspired about your comments about the housing crisis. My question, though, is more personal. You mentioned your relationship with Boston Children's Hospital. As a parent of a child who's traveled to Boston frequently for services, they obviously do a wonderful job, but it can be a big financial commitment for parents who are working to take the day off work, stay overnight in hospitals. So I was interested in what those services are in Hyannis or elsewhere on the Cape that can help our working parents who have children that are being treated at Children's Hospital, particularly for outpatient services, to avoid those costs and help our local families. Thank you.
Yeah, it's a great question. We partnered with Boston Children's Hospital because we had no choice. They already had, and this is the danger of being a community-based independent healthcare system. They came down and convinced all of our pediatricians to join their physicians organization. What are you going to do? We lost. We do have 4 employed pediatricians, and I will say, when the state had an immigrant crisis, particularly as it relates to TB and 37 babies delivered in 3 months, you'd be proud to know that your not-for-profit healthcare system and your locally employed pediatrician stepped up and did all that coverage. Yeah, I could go on and on. I think that we partner with them to make sure we have great pediatric hospitalists in our community to keep sick kids here. They help us coordinate if they need to go to Boston. We need to be able to do more pediatric ENT procedures here, more pediatric orthopedic procedures here. We're never going to be able to recruit because there's not enough of us. We're the 3rd oldest county in the country, by far the oldest in Massachusetts. There just aren't many kids. Part of why we need to keep nurses, and we need to grow EVS, and we need to grow therapists and diagnosticians. We need to make sure that we're growing our workforce and having families on the Cape. We need to fix housing because of that. But yeah, the pediatric quagmire is not going to leave. Boston Children's Hospital is the best of the best, so if you're going to partner with anyone, do it with them. We have some second clinics down here, particularly in GI. I know that we house them in Sandwich, but I don't have a great answer for you. The best we can do is partner and try to keep as many kids local as we can. And by the way, even though our pediatricians join Children's Hospital Physicians Organization, they're still housed here. They still see all of our patients, all your kids. I mean, they're still here. You lose some of your flexibility because of it. Vicky, please, softball. These questions have not been easy so far.
I just wanted to know if you were thinking of doing anything directly with housing, like making some on-campus housing, or rather than working. And you probably could get a partner for that, but just contemplating using some resources that you could maybe raise to create some of your own housing for employees and et cetera.
Yeah, I recently said in the Cape Cod Times that I didn't think I wanted to let the market take care of the situation, and then I realized that the market wasn't going to take care of the situation, and maybe I'm a little late. I remember Michael asking me during the pandemic, "What are you going to do about housing?" And I'm like, Mike, I'm dealing with a little worldwide pandemic here. Like, give me a break. But he wasn't wrong, and now that I shake my cobwebs out, we're going to have to be creative. We have some buildings, we have some land. We partnered with New England Development to build 232 units at our Addicts Way property in Hyannis. Rather than sit on property and watch it just kind of, sleep, we created meaningful housing strategies. But listen, it took us 6 years to do the project. There's not many developers that have deep pockets like that can sit on it for 6 years. So we have to make it easier. All you business leaders, please. We're going to do something. I just can't. Financially, we have a strong balance sheet, but financially, it's been a rough 4 or 5 years, and we have put all of our money back into this healthcare organization. We're expanding on the Hyannis campus. Not only did I mention trauma and the cardiac surgery program, we've had to rebuild cardiology from scratch, and rightfully so. We made the right decisions, as difficult as they may be, but they were the right ones. And to be right and pay such a significant price is never easy. But trauma is a key program, cardiology is a key program, oncology, the new Barbie Pavilion, new cancer center. We have the linear accelerator here, Jim and Ruth Clark, who I miss so often. Got to meet their daughter. I knew their daughter, saw her again recently. We're going to make sure cancer services are here on the Cape. We're going to make sure that our incredible orthopedic team is here in Falmouth Hospital. We're going to make sure, and that's led by Dr. Diamond, and now we have 6 full-time orthopedic surgeons here, really doing incredible care. Cardiology strong, general surgery strong, ER strong, working on primary care every day, getting better. We have access for PT. JML has remained open. Each and every day, just so you guys know, we open JML, we lose $5 or $6 million a year on JML, and we do it for the community. Most others have sold the assets already. And I'm not here to, I don't expect you to say, wow, blah, blah, blah. You need to know what your health system is. Not what it does, what it is. And the fabric of who we are is to take care of our community heritage. Great place. Wonderful people. I mean, all the employees. It's not easy to work in skilled nursing and assisted living, nor in hospitals. Would you have ever imagined that at every entrance we have signs saying that if you're violent and mean to our staff, you're not welcome back? That's every day. Every day, somebody gets verbally or physically assaulted in one of our 2 hospitals. Every day of our lives. Just never thought I'd see it coming. But here we are. And we'll just try to lead with kindness and thoughtfulness. And in reference to housing, I think we could ultimately do dormitory style, but what do you say? What was great? The unsung hero during COVID? Of course, doctors and nurses, right? But what about the EVS employee, right? Environmental services employee, the terminally cleaned 10 COVID rooms a day. That's a single mother with 3 kids at home. Do you know they never called off work? Heroes? Making $20 an hour? Those are heroes. I love those people. Yes.
Hi there. You did a great job giving an overview of your specialties and stuff, but the one that I haven't heard was neurosurgery. And with the aging population, what is your plan to expand on your neurosurgery program?
We've just
Or is there?
Well, it's great. So we have a dedicated neurosurgery program. We have 4 neurosurgeons that are incredible. And we just recruited our 5th that is in his 2nd year of fellowship at Columbia that will be joining us next summer. And that will really, I think, get us a little younger, do great succession planning, because it was funny, when I got here 16 years ago, we were all in our late 30s, and we're looking around the other day having a meeting, and we're like, oh my God, we're all middle-aged, it's over. That was a reality check. But I digress. Not only do we have a strong neurosurgical program with some of the most advanced techniques in terms of head, neck, and cranial surgery in the Commonwealth, our outcomes are incredible. But we also have comprehensive pain management program, both in the Upper Cape over here, as well as in Hyannis. We have some really nice assets. And by the way, as I continue to say, healthcare is changing and evolving. It's going to look different in 5 years. Where care is delivered is going to look different in 5 years. In 2000, 80 cents of every dollar was spent in a hospital. Today, it's less than 20 cents of every dollar is spent in a hospital. Most of it's in the ambulatory world. And you think about some of the advancements being made in the pharmacologic suites, the boutique drugs, the lives that we're saving or improving or elongating. It's changing, and it's changing rapidly. It'll be interesting to see where we end up. Yes.
I'm just curious, given the Steward situation, what percentage of I don't know if you know this, but what percentage of hospitals across the country are owned for profit?
You know, I don't know that, and I'm not meaning to indict for-profit medicine. I think you have the HCAs and the Tenets of the world out there that are pretty good. And by the way, we had a good partner in Steward with many years, but we saw what was happening and what was coming. I don't know the answer to your questions, but I don't want to indict all of healthcare, nor do I want to indict private equity. I just think when you're completely, when these communities are completely dependent on their hospitals, leveraging those assets isn't the best solution. And you know, I'm happy to say the Cape Cod Hospital, Cape Cod Healthcare, Falmouth Hospital, we have one of the lowest debt loads in the country as a system. We've invested over $1 billion back into our healthcare company over the last 14 years. And to this day, we only have $100 million in debt, actually $95 million. When I got here 16 years ago, we had over $160 million in debt. And I would say that our assets were woefully undercapitalized. So I do want to let you know, although all that performance that our team has done has gone back into our community.
I think I'm next. Good morning, Debbie Rogers. I have 2 questions for you. The first one is, you touched upon the mobile at-home care that you're working on. About a year ago, I had the opportunity to have a full tour of the mobile rig for Mass General Brigham. Can you expand on your plans, what you're going to be purchasing, what we're going to see in the community, what the services will be? My second question is, this is not a problem unique to Cape Cod Healthcare. This is a problem across the country. Wait times in the emergency room. What are your plans to work with that and try to improve the times that it takes to get people into the emergency rooms, get them seen, get the tests they need, and get them out? Thank you.
Thank you. So I'll touch mobile integrative health and hospital at home quickly. Does anyone know, every time I hear somebody from Mass General Brigham, right, they're the world's leader, every time I hear them speak, they talk about hospital at home. Do you know how many patients we have in total in the Commonwealth and at home? 100. You know how many people we have boarding today? 1,500. So I think they're making incredible advancements in studying it. But you know, independent blue-collar healthcare organizations like we are, we have to learn from others and try to do it a little differently. So I think they're doing incredible research and modeling at places like MGB. We hope to steal a little bit from that and do it a little differently. I don't think hospital at home is going to save us because people are sick, by the way. Coming out of COVID, people are sick. But there's some that can go home and should go home. I think the better key is to make sure that you have primary care physicians, that you're actively communicating with your patients, and you have groups of people that can go into homes to keep people healthy and safe. We have groups of people that can see you post-discharge within 72 hours. And we do know we can decrease readmissions by over 50% when we're able to do that. So I hope we go there and learn from others. But yeah, I like to poke fun of the big academics because they don't even know we exist. But the fact of the matter is most care is provided in the community, and we can learn from the incredible work that they do. And some of the things they do are amazing. In reference to the second half of your question, I don't think we have a problem getting people into the ER. 90% of all of our patients are into a bed within 25 minutes, seen by a doctor within 40 minutes. We track those stats and metrics daily. We do have a little bit of a problem, right? How do you get people upstairs and how do you get people out? It takes 3 hours to get somebody discharged from an ER today. And just to put that into perspective, I used to go crazy, like, we gotta be 120, we gotta be 120, we gotta be 120. You can't get the testing back now until 2 hours and 27 minutes. It takes 2 hours and 27 minutes to get all your results, from your CT, your blood work, your imaging. I've tried it every way. I can't do it any better than that. They can't do it any better than that. Because we gotta make sure you're healthy. You're there for a reason. So it takes 181 minutes to get discharged. By the way, 95% in our urgent care center, being seen by the same physicians that you see in the ER, 95% of the time you're out within an hour at 60% less cost. I just been coming to Falmouth 16 years and took a wrong turn on a back road this morning and I ended up in our urgent care center. I think it was God's intervention. So I think that getting patients upstairs is another matter. It shouldn't take 6 hours. We have to do better. If we know what's wrong with you within 2 hours and 27 minutes, we should be able to get you upstairs a little sooner. So I think that's what we're going to work on this year. And some of it has to do with the skilled nursing environment. Some of it has to do with the lack of primary care access. Some of it has to do with the lack of specialist access. I have to own that and get better at that. So I'll own that. I think our team's doing an amazing job, though, in our ERs. Great question. Thank you.
My question is in regard to the aging population here in Falmouth, and how does that impact Falmouth Hospital and its future? Is one of the reasons why you moved the maternity ward out of Falmouth is because there aren't many families here, births here?
Well, when you're delivering 325 babies a year, it's not safe. How do you keep the competencies up? And then the pediatric world has gone, as I mentioned earlier, you have people that are ambulatory now and people that are acute. And we no longer, our pediatricians that hung in there a long time for us determined that they could no longer support our obstetrical suite because you have to have them there when you deliver babies. And it's complex. So that is the reason we brought the two organizations together. We have 14 obstetricians on the Cape, as well as a obstetrical or gynecologic oncologist that comes weekly. I think the ICU was designed, and if you haven't walked through there, it's amazing. It's really, really quite great. You need to recruit today, and you can't do it with lousy facilities. People have choices and options, but also technology, also work environments for retention. If you were ever in our old ICU, it wasn't very attractive. It was frankly awful. The care was great. The facilities weren't. So complexity, employees, patients, all the things. So we want to keep them there. The aging population on the Cape is going to be interesting, and I think we're going to have to manage them differently. We're going to do some new innovative things with CMS. We're doing new and innovative things with Medicaid 115, the 1115 waiver. Everybody else complains about these payment methodologies, and I could complain about them to you because we don't get our money for what we spend. but I think there are opportunities. They make you do things differently? Because the only way you're going to get back to break even is to be better. So we have to figure it out. So we're just going to keep investing in resources we need. As I mentioned, our HALO programs, when you think about cardiology, orthopedic care, oncology, neurosurgery, primary care, emergency medicine, general surgery, if we can be good at all that, Falmouth Hospital will be open for the next 60 years. Yes, ma'am.
We hear all the time of the shortage of primary care physicians here in Falmouth and on the Upper Cape. What is your vision for doing something about attracting and retaining primary care practitioners?
Well, my vision is to bring Grover Baxley, Art Crago, and Jim O'Connor back. That's my vision. So if you see them, can you please beg them? I need them. You know, I mentioned a little bit earlier, we have Dr. Miller over in North Falmouth. We have another partner coming to join Dr. Miller in the summer. Dr. Elber just started over at the medical office building at the hospital. Dr. Korn's clinic that has not only Dr. Korn, but 7 nurse practitioners. We have at least 8 full-time primary care physicians in Sandwich. We have 3 plus 1, 4 in Bourne, 4 or 5 in Mashpee. We have places in Catuit and Osterville. So we can always do better, but if you call today, our line for primary care physician, we can get you in this week. So it's not perfect, but it's good. And we learned how to be better because we hit rock bottom coming out of the pandemic. I mean, we were losing a lot of docs. Doing surveys, I mean, I got tanked pretty good. And so we had to sit down and learn how to answer phones differently, how to communicate with patients differently, how to recruit differently, what do the doctors need, how do we support them differently, our nurses, our models, innovation, leveraging technology, all the things that we had to learn from. So we're working at it. It's a work in progress. It's not perfect, but I would say I think it's pretty good here now. Good not being great, and great is the vision. The vision, aside from bringing those 3 great people back, is to really have enough primary care physicians on the Cape where we can completely integrate and coordinate your healthcare. That's the vision. And I don't know what that number is, but we're not going to stop till we get there. Sorry, go ahead.
I've got a related question, actually. I mean, whether it's just recruiting and retraining primary care physicians, or you've also talked about the hospital at home program and facing some headwinds with care providers not necessarily wanting to opt into that program, or also with nurses wanting to be per diem as opposed to full-time. And I'm curious what you understand to be driving some of that, right? Because obviously people who go into nursing and into medicine do that to help people, not necessarily to get rich. I don't think that, I believe that there's got to be something other than just that's inconvenient or I don't want to do that, that's at work there. And so I wonder what you understand to be some of those other drivers. What's the external need for flexibility, or what's the hesitation with opting into hospital at home, and how do you alleviate some of that?
Well, I don't think, as I said, no matter what, we wanted to have an average daily census of more than 10. Like the big systems have 30 and 40. You know, we're $1 billion. MGB is, 10 billion, and they have 50. So you kind of look at that. I guess my point is hospital at home isn't going to save the day. And we already have an incredible VNA that has an average daily census of 12 to 1,400, that has comprehensive hospice and palliative care services, and we cover the islands when their own parent company in Boston won't. So I think we have a pretty good medical at home program already, but how do we coordinate and put inpatients in their homes? And that's yet to be determined. I think that life flexibility, we didn't have this problem before COVID, so what happened after COVID? Why did people suddenly go per diem or quit? I think that 1, administratively, I could have done better. I think that 2, I mentioned violence. 3, I don't know that you appreciate what these people went through for 2 years. I don't think you do. I do. It was awful. They ran in every day. If you don't think that doesn't take a mental toll on you, you're mistaken. Every day. Do you have the right PP&E? Right? Is it aerosolized? Is it droplet? What is it? Will it kill me? Will I ever see my kids again? Yeah, that was real. And by the way, then everybody became a complete jerk after COVID. Everyone started yelling at everybody and physically assaulting staff. And then you're boarding patients that are critically ill, you know? And you put it all in the bag, and it's not very good. So I think I can do better. I think society can do better. I think we have to give them more recognition and communication. I own that too. I think that they want to take great care of patients. I think that's what I love about our staff and all of nurses and doctors and techs and aides. Everybody wants to take good care of people. It is not a glamorous job, but it is one of the best jobs. All those things factored into where we got to. And life is a little bit of it. So we just have to make sure that listen, I'm lagging. I have to do better. I have to figure out this traveler mess. I got to figure out how to get these per diems back. That's something I have to do better this year. I just haven't cracked the code. God, I've tried a lot of ways. I can't crack the code. I don't know what it is. Talk to my peers, they've cracked the code. I haven't cracked the code. I worked for a guy one time that demanded, he was from Falmouth, by the way, he demanded that I had to tell him everything I did awfully this past year. So in ode to him, I want to tell you that I need to do better in that. Yes.
Sorry. Thank you. It's been very enlightening. Can you give us a brief update on behavioral? What's going on? How much you have to face? And where we're going?
Well, yeah, that's it. I think society has behavioral health crisis. And, I look at that phone and I resent it. And I can't help but think that that's the incidence of what's going on with social media and phones. And, there's no way in 2008 you can board 7 people, a year, pediatric kids, and now you have 7 a day. So what's changed in 17 years? Well, that damn thing has changed. I know that. But that's anecdotal. We have a crisis everywhere. We don't have enough beds anywhere to satisfy the need. But what can we do, again, in homes? Telemedicine is very useful, excuse me, when it comes to behavioral health. The state's working hard. They've partnered with us in mobile integrative health. It's easier to get people admitted off Cape now for these services, and finding the right partner on Cape to expand behavioral health units, and not only for behavioral health, but also pediatric issues like anorexia. There's so much that we have to do. But what do I do? Like, I could hire, you get this, right? I could hire 25 neurologists on the Cape. That's what we need. We'd be out of business, but we'd be serving a need. What's our sweet spot? So neurology is another key. I know somebody asked me that question earlier. Neurology is something Dr. Leahy, we're so fortunate to have him here, but we need bigger neurologic groups. See, we're trying to get big groups that will cross-pollinate 2 hospitals to serve our patients' needs, because you can't recruit into one. Like Doug Mann, a former ENT, he was one. Nobody wants to come and take call 4 days a week. But getting back to behavioral health, I like the fact that we have a dedicated inpatient unit on the Cape. We have partial hospitalization where you're sick, but you're not acutely sick. So we can take care of you all day and then go home at night. We have strong outpatient clinics. We have NPs that are dedicated. We have new advancements that are coming. I love what our psychiatrists, psychologists, NPs, behavioral health work team are doing. They're amazing people. They're heroes, honestly, as all healthcare workers are. And then we just need to figure out, how do we care for these people across the Commonwealth, and what does it look like in the future on the Cape? Much like housing, we're probably going to have to get more involved. Yes.
So as a father of a young nurse who would no way work on the Cape because she wants to be in Boston, how do you kind of deal with that issue? And I know you said you have some partnerships with UMass and community colleges, but I would think that a lot of graduating nurses, you know, want to be more in the Boston environment and some of the big hospitals. What type of value proposition are you giving them to get them to come to the Cape?
Well, I think the nursing care that we provide is second to none and maybe the best. Everybody that comes here appreciates how our nurses do it and how our nurse leadership does it. I think, just as I mentioned earlier, we need to communicate effectively with them and convince younger nurses that we don't mind that you're going to leave in 3 years, but we're going to invest everything we can into you, and you're going to be incredible when you leave here. So when you're ready to come home and start a family, we're going to be waiting, and you're going to be exceptional. And that's, you know, I went and Mary Johnson, our other CNO in Hyannis, we went and talked to the HR leader at, or heard a presentation on the HR leader from LinkedIn. Fascinating stuff, but that's what they want. We can't offer them nightlife, but we can offer them that pond, right? And we can offer them oceans, and we can offer them trails and hiking and biking, and we can offer them outdoor space, and we can offer them, you know, campfires at Sandy Neck, and we can offer them 20-minute rides across the Sound to Martha's Vineyard, and we can offer them a lot of things, right? I can't offer you nightclubs, but if we can demonstrate to them that we will invest in them and it's okay to leave and it's better to come back, that's our sweet spot. Yes.
I know you're summing up, I think, and I just want to thank you and your senior staff for being here. But also I want to thank Michael and the Chamber for putting on this very important event. So thanks for being here this morning.
Thank you. You know, I was expecting you to give me the hook, Mike, not... I love it. I also want to recognize some other members of my team. Mike Jones, who's been with me for 16 years, a true Falmouth-centered person. You can't do it without him, so thank you, Mike. And our foundation staff, Debbie Doherty and Nancy over there, and Beth and Jen, and anybody I missed, I'm sorry, Robin Lord. I work with a really talented group of people that all support this great institution. I'm thankful. Thank you all very much for having me.
Thank you. Thank you. Thank you. Thank you all for coming, Mike, for answering all those questions. You know, one thing, you know, Mike had just identified some members of the team, but the other thing I think you should know that's so important with the Falmouth Chamber is that, you know, we have a very diverse board of directors because we do consider ourselves the community connection. We are not a business-focused organization. We're a community-focused organization. And I'm happy to say for the last 16 years, there's always been someone from Cape Cod Healthcare, right now Deb Doherty from the foundation, on our board of directors so that the information is shared between the business, the nonprofit community, and Cape Cod Healthcare. And that's what kind of created the environment for today, for Mike to come out. You know, I've known Mike a long time. I know he really cares about the community. We've had great conversations. We've had hard conversations. We've talked about everything. But I know the heart is there, and Cape Cod Healthcare is dedicated to our community. So, Mike, thank you so much from the bottom of our hearts for all that you do, for all that Cape Cod Healthcare does for Falmouth. Thanks, everybody, for coming.